Hey everyone, our project is on necrotizing fasciitis, and it's by Greg Hill, Jackie Lynch, and Caitlin Gatto. Um, so I'm Jackie Bench, and I'm going to start with the etiology of this disease. So it's caused by Minibacterium, but really it's caused by two types of bacterium mainly. And the first one's Streptococci, mostly Streptococcus pyogenes and Streptococcus aureus, and it's also caused by Staphylococci. I've added a couple of gram stains to this, and so you can see the one on the right is the one that looks like chains is Streptococci, and the one on the left that's kind of bunched together is Staphylococci. This cell is gram positive, and its morphology is coccus. And so as you can see in the cell that I've provided here, that has a thick peptoglycan cell wall, and it's shaped as a sphere. And it's also non-motile. For treatment of necrotizing fasciitis, the most common treatment is strong antibiotics given through the vein. Also, a big thing that needs to happen if the infection spreads a lot is you need to remove the infected areas. This often involves removing tissue, or if it's a big enough area, like in your arms or your legs, then you need amputation. And then also many patients, if it spreads enough, need wound therapy. And I've shown a picture of this. It's kind of a cool way to just keep your wound clean and sterile and to promote healing with it. So for prevention of necrotizing fasciitis, probably the biggest one is good hygiene. In all the research I found, it talked about washing your hands, making sure that you just stop that bacteria from being able to grow. Along with that, taking good care of and efficiently cleaning any wounds, because this is obviously where necrotizing fasciitis is going to dwell the most. And so really just cleaning your wounds, taking care of it. And then another huge thing is to see the doctor at any first signs. The sooner you get into the doctor, the less traumatic this disease is going to be. If it just barely starts to spread and you start to notice it and you get into the doctor, then he'll only need to remove a little bit of this instead of having to go as far as the treatments we were talking about before, as amputation or removing a lot of tissue. If you get in there quickly, all that will need to happen is getting an antibiotic shot.